Hi there, Mr. V. How are you?
I'm good. How are you?
Good, thanks. I'm Dr. Smith, and today we'll be conducting a virtual visit. And I understand these visits can feel uncomfortable since we're not in person, but I assure you that we're on a secure server and it complies with HIPAA. But before we begin, I just want to make sure you're in a location where you feel comfortable talking to me.
Yes, I feel pretty good here.
Okay, great. Then let's begin. And I also understand this is a wellness check-in for you. Is that correct?
Yes, I don't have any particular concerns today, but I do, however, have some questions about virtual appointments in general.
Okay, sure. Go ahead and ask them.
So this is my first virtual visit with a doctor. What kind of things can be done virtually versus in person at a doctor's office?
That's a really good question. So these visits are mainly for instances where patients are coming to me for wellness checkups, such as the visit we're having now, or other health concerns that don't require me to be physically in the room with the patient, to touch them, to listen, to look closely. So any physical exams or vaccinations will need to be done in person, but follow-up appointments, counseling and education, medication management, and behavioral health services are all types of visits that can be done virtually on a call like this. So wellness checkups, such as the one we're having now, are really highly encouraged, especially in this time of COVID-19. And you can always call your doctor's office and describe your concern to see if a virtual visit is appropriate or not. Does this make sense?
Yes, I understand a lot more now about the different services that I can expect. So thank you very much.
Okay. And do you have any other questions?
Yeah, so can you explain to me the different ways that I can get in touch with you virtually so that I don't have to come into the visit but still get tested?
Of course. So most doctor's offices have an online patient portal where you can send messages directly to your doctor, like an email or a text message then sent through a secure network. And your doctor and the rest of the healthcare team will usually respond to your message within 24 hours. And
Okay.
I find this method to be the easiest to speak directly with your doctor.
Okay.
If you need to schedule an appointment, you can go online through the portal or call the doctor's office directly. And once your virtual appointment is scheduled, your doctor will contact you via cell phone or video um, on the patient portal. And they'll explain to you what you need to do in order to prepare for the visit. But oftentimes, you just need your cell phone and a Wi Fi connection or internet, and you'll be able to get on the virtual visit fine. Does that make sense?
Yeah, it does. Thank you.
All right, perfect. So let's move on to the wellness checkup.
Okay.
Why don't you start by telling me what a typical weekday looks like for you?
Okay, let's see. So I usually get up around 7 o'clock in the morning. I make sure my kids are up and ready to start their day. I usually have like a bowl of cereal or toast for breakfast, and then I start work and by logging onto my computer. For lunch, I'll usually have like a frozen meal and some chips. And then right around 6 o'clock or so, I finish working. I start cooking dinner for the children. We don't really finish up till around 8 o'clock, at which point I help them with homework and they play a bit of video games. And then around 9 o'clock or so, we're winding down for the night.
Okay, so it seems like that you work a lot, but you still find time to be relatively healthy
Mhm.
and spend time with your kids. So that's good to hear. Regarding your diet, I do want to mention we can offer a referral to a virtual nutritionist if that is something that you'd be interested in.
I didn't know that service was offered, but I suppose I'd be interested.
Yeah, a lot of our patients are unaware about that, but it is a great service, and I'll have one of our nutritionists reach out to you soon.
Okay, great. Thank you.
Another question, do you check your blood pressure regularly?
No.
No. So I can actually prescribe you a blood pressure monitor um, that's automatic and you can pick it up at the pharmacy. You can monitor your blood pressure at home with it, and we can schedule a virtual visit to follow up regarding your readings, and I can answer any questions you have about them. We can go from there if we need to manage your blood pressure with medications or diet or what have you.
Okay.
Does that sound something you'd like to do?
So I'm on Medicare and I'm just wondering how much will this cost me?
So if you have Medicare or Medicaid, the blood pressure monitor is completely covered
Oh,
by
that's
insurance.
that's great.
Yeah, absolutely. How much do you smoke and how much alcohol do you drink?
I'd say I probably smoke about a pack a week, and I'd say 5 drinks a week, maybe.
Okay, thanks for sharing that. I do want to mention that our doctor's office now offers virtual smoking cessation, which I definitely would recommend to a patient like you. Is that something that you might consider?
I mean, I have been wanting to quit for quite some time, but it's been difficult. But I guess I would be interested.
Yeah. Okay, so I'll make a note to speak to you about that during your next visit. And can you tell me a little bit about what your home life is like?
It's good. It's just me and my two girls. I have a 1-year-old and an 11-year-old. We're doing okay. I'd say it's challenging finding time with my busy work schedule to spend quality time with them. And my children are at home with school being virtual. And so this is really adding extra stress to my life right now, because I have to look after them and do work at the same time.
Yeah, I can see how that can be very difficult for a lot of our patients. That's what's happening right now. Um, but we do offer virtual counseling sessions, which might help you cope with these stresses at home. I would recommend them for you. Is that, something that you might want to think about?
Yeah, I guess I'd be willing to consider that right now.
Yeah, okay. Um, have you and your kids received your flu shots this year? And are your daughters up to date on the other vaccinations that you know of?
Yeah, so no one has we haven't received our flu shots this year. And I think my kids were supposed to receive their vaccines at their wellness visit this year, but because of COVID, I didn't really want to bring them in for fear of contracting it. So what do you think I should do?
Yeah, I can understand that is a tough question, and a lot of our patients are struggling with the same thing about whether or not they should get their vaccinations or not out of fear of COVID. But even with the COVID-19 virus out there, I still highly recommend all of you receiving your flu shots. And
Okay.
about your daughter's other vaccinations, these immunizations are crucial for them to receive at this stage in their life, and they really can't wait to have those vaccines later.
Okay.
So doctors' offices are taking precautions to reduce the spread of COVID-19. And I would just highly recommend that you and your daughters also take the precautions when you're traveling to and from the doctor's office, like wearing a mask.
Hmm.
And anyone over the age of 2 should be wearing masks at this time. Um,
Yeah.
I would recommend, washing your hands, reducing the number of surfaces that you're touching in order to get yourselves to the clinic to get vaccinated.
All right. Thank you for explaining that. I guess I wasn't really thinking about how important these vaccinations are for my children, and the flu shot, it's been hit or miss. So I appreciate hearing the importance of it. And so I think we'll definitely look forward to getting those.
Yeah, I really can't stress it enough that you really should be getting your
Okay.
flu shots and your daughters to get their other vaccinations as well.
Okay.
Um, do you have any other questions for me today?
No, none at all. Thank you
No?
very much.
Okay, well, if you don't have any other questions or concerns, I'll see you at your next wellness checkup. And I encourage you to schedule your children's checkups as well. You can call their doctor's office or go online to schedule these. And I hope you have a great rest of your day.
Thanks.